then we can proceed with the program. Subhashi, can we start with the talk now? I would request Professor Narayan to speak the opening remarks, please. Professor Narayan, can you hear me? Sir did say that he's going to have some network issues. Um, we have the great scientist, Dr. Harihar Chandra, who's an ecologist, with us today. Sir, would you like to make some opening remarks before we go on?
Thank you, Dr. Bindal, and namaskar to Panditji once again, and to
To
Professor
all of you.
Narayan, and to the rest of the audience who are listening to us. It's my second time on this
Am I
platform.
audible?
Yes,
Yeah,
we can
yeah.
hear you
Yeah,
very
madam, you
well.
are audible.
Okay.
Yes. It's
So,
very nice to
Mr.
know.
Pandey, would you like to make some opening remarks? Because I,
After Professor Hariharan,
Yeah,
he has just
I
can you
started.
hear
request
me?
him.
Dr.
Yeah.
Bindal,
Yeah.
can you hear me? Are you able to hear me? Yes. Dr. Bindal, can you hear me? No, I don't think she can hear us. I think she has a problem. Dr. Jyoti Bindal, can you hear me? I think you need to check your audio.
I actually cannot hear Professor Hariharan.
Exactly. I think you have a problem on it's one-sided. We are able to hear you. Uh,
Yes, sir, you can continue, sir, for the program. In
yes.
the meantime, Matthew
On
will.
Subhasji and the team, can you please help Dr.
Um,
Jyoti?
Yeah,
Mr.
we'll
Pandey,
do.
Subhasji, you have to speak to her on her telephone probably because she can't hear us now on this
Right,
platform.
sir. Right, sir. We will do that. You proceed with your decision, sir.
Yeah. Okay. So, no, but she needs to hear. It's important that she also understands the context.
I think there
Yes,
is some
yes.
network issue because I definitely cannot hear Professor Hariharan on the my speak.
Subhasji, we will wait. It's okay. We'll wait for another minute or two. Doesn't matter. As long as you can get the audio straightened for both Dr. Jyoti and for Professor Narayan. Subhash, Panditji, I think only the two of us are able to clearly hear each other. And
We can certainly interact and chit chat a bit.
well, we can do that.
I keep on visiting Bangalore. I had been there,
Oh, oh,
and I had
wonderful.
a brief course also in IIM. So I was
Really?
there. Hmm.
Sir,
So when you are next in
we
Bangalore,
are
you
able to
should.
hear you.
Yes,
You can
Subhasji.
So,
I
start,
think
sir.
I think
Subhasji, the
we can
challenge.
request Professor Hariharan to set the
I
ball
can now
rolling.
hear. I can hear
Okay,
now.
okay, okay,
The
madam. Okay, madam.
All right.
yeah.
You can hear us, Dr. Vindal?
Yes, now I can.
Oh, lovely. Okay, so in which case, I think I will maybe, as you requested, and as the
Once
Panditji
again,
was
I
also
cannot.
saying, no, she's not able to hear
But
again. Subhasji, you
But
have to rescue her.
I am audible to her
let me
also
go
and
to
to
some
you
other
also.
area, maybe.
Sir,
Okay.
you are audible to us. You can proceed for the
All
decision,
right.
N-
sir.
Lovely.
Now
So,
I can hear you.
In the
okay.
Yeah.
meantime, we will
Okay.
connect with you.
I think,
Now I
all
can
right,
hear.
let's get begun. Let's get started. We'll see how it goes. I will make some very few remarks in the beginning in order to see if we can get the conversation going. When we talk heat waves and its impact, it's something that affects multiple systems of the human body. If we are talking just physical health, there are immediate risks in terms of heat strokes, dehydration,
हमारे वहाँ कोई
exhaustion.
नेटवर्क ही नहीं आ रहा कुछ.
Dr.
Please go
Jyoti,
ahead.
we
Please
can't
go
hear.
ahead.
Yeah. Beyond all of this, when we talk of heat and we talk of climate change and we talk of impact on humans, I think the first thing that occurs to me is that in terms of either governance or in terms of administration, we need to be looking at how some long term and short term measures in our cities are brought in with administration very significantly recognizing one single fact, that it affects communities unequally. The low income households, informal settlements, outdoor workers like gig workers who work for Swiggy and other such companies, and people without access to cooling face the greatest threat and exposure to such UHI effects or urban heat island effects. Now, it's easy for us all to sort of categorize it under climate resilient planning and ask for prioritizing of such measures for mitigating the impact that it makes on vulnerable populations. It is not easy. The other three or four factors that we must remember, and what I think we all can work on, and without much as either economic, stress, or in terms of what communities can do, are the following. One, how can I ensure that the urban construction traps that that traps heat and increases lower temperature is managed better? Which means my town planner has to ensure that when he gives us a sanction plan, that there is a certain amount of greening that happens in the building that I want to create. If you take Singapore, for example, I think it was in 2011 or 12 when they said that Singapore is a city within a park. And they seriously, in right earnest, worked to see how their master plan began to recognize the downstream design approaches that the architects had to take in order to make that happen in Singapore. The obvious things I don't want to discuss, you're all discerning people here, are the following: concrete surfaces, traffic intensity, for instance, and that bring heat stress. What we need to be doing, of course, to see that we revive our lakes and our water bodies, as well as those city rivers that have become sewers. You go to Pune, you have got, you know what has happened to Mula and Muta. You come to the city that I inhabit called Bangalore, we have five rivers, and all of them only take 100% sewage water. If I go to Chennai, for example, and I've been working along with an entire group on a climate action plan for Chennai, and central to, of course, such an exercise and an initiative is climate change and heat impact or heat wave impact. And there we find those two rivers called Kuam and Adyar have the same challenge: 100% sewage water. You go to Vashisht, which is in Vadodara, you find the same problem. So, what has happened to all of us is that over the last maybe 50 years, from about the mid 1970s, we have chosen, our town planners have chosen, our administration, city administration has chosen to see that our sewage water goes into those rivers, and we have become unmindful of this devastating impact. I will pause here for me to see that I listen and learn from Sri Pandeji. He did mention at the beginning that we have got the first top 50 cities in the world that are at the highest as temperature goes, being from India. And of the top 100, we have 97 of those cities as of day before yesterday. Panditji, I'd like to stop here and see if I can, shift the mic to you. Yes, Panditji. You heard me? Yes. You have to unmute, Panditji. Dr. Jyoti, did you hear me?
Yes, I could hear you. Thank you so much.
Wonderful. We will now wait for Mr. Pandey. He has to unmute. He's not able to. Yes, you got it. You got it, Mr. Pandey.
There is some network issue with me also.
We can hear you
I
now.
can't hear any of you.
Oh, okay. But we can hear you. We can hear you. Maybe Mr. Pandey, if you shut down your video, maybe your network will work better. No, he can't hear us at all. Subhash, you have to come
Uh,
to his rescue.
so And Subhash, you'll
Yes.
also, whenever it's my turn, you need to project my PPT.
Okay. Go ahead.
Yeah, go,
Just
madam. You can go ahead. I will present the PPT.
Okay. So, um, can I have the first slide, Subhash? Yeah. I hope Subhash's screen is visible to everybody.
it's buffering. Yes.
It is
Yes, we can see it.
Okay.
visible, ma'am. You
S-
can go ahead.
Okay. So we are talking of a scenario where they have literally 4,92,000 people dying because of heat wave globally. And we need to now understand that heat waves are literally an emerging public health threat. And we need to recognize the health impacts, the vulnerable populations, and also see how we can prevent it. As Professor Hariharan said, prepare it for it, and we should have some policies in place. Now, heat waves are increasing not only in frequency, but also in duration and intensity all over the world, and thousands of deaths. And as I gave you the numbers, 4,92,000 deaths are occurring globally. And in a particular region, there could be more deaths being caused by heat wave than floods or cyclones or earthquakes. And this makes India one of the most vulnerable countries because of its geography, because of its population, density, and urbanization. Now, we do define a heat wave as a deviation from normal maximum temperature. And whenever temperatures rise substantially above the thresholds, we call it severe heat wave. The risk increases with humidity, with poor ventilation, and prolonged exposure. And nighttime temperatures are important predictors of mortality in the world. Now, global warming has definitely increased the baseline temperatures, and extreme weather events are more common. But as Professor Hariharan said, urbanization is a huge major cause which amplifies local temperature rise. And climate models do predict that in South Asia, the heat exposure is going to definitely worsen further. In India, if we have 2015, it only cost more than 2,500, but today number is much, much higher. And as on today, several states are reporting temperature above 45 degrees. And if I talk of Gwalior today, it's definitely 44 degrees here. Cities like Delhi, Ahmedabad, Nagpur, they all are facing the rising heat stress. And this causes definite loss of productivity on economic impact because any population which is outdoor cannot work. Now, what is the pathophysiology? Basically, the body normally dissipates heat via sweating and by vasodilatation. But when heat gain exceeds the heat loss, then a state of hyperthermia develops. Dehydration further reduces the sweating efficiency, and this causes cellular injury, inflammation, coagulopathy, which is the clotting within the blood vessels, and multi organ dysfunction. Now, this is just a diagram just to tell you the steps and the in layman terms, if I take it, the venous blood collects, and this causes hypotension and cutaneous vasoconstriction, which is actually literally on the borderline of causing mortality. Now, certain spectrum points are one is, of course, heat cramps, which are painful muscle spasm, but there's also heat syncope, where the patient may collapse because of vasodilatation. There is heat exhaustion, which is weakness, dizziness, tachycardia, and heat stroke, where the temperature is above 40 degrees, it can cause CNS dysfunction and organ injury. And here I want to tell you specifically that for heat exhaustion, you need not be outdoors. It can happen indoors also when the surrounding temperature all over is very high. It can cause medical emergencies. It can cause symptoms like confusion, delirium, seizures, and coma. Hot, dry skin or profuse sweating. Complications like respiratory distress syndrome, acute kidney injury, liver failure, disseminated intravascular coagulopathies. So mortality comes very early in these cases, and unless we treat them promptly. If you rapidly cool a patient of heat stroke, it is life-saving. Cold water immersion or evaporate cooling. These are the methods to help in heat stroke. ABC stabilization, IV fluids, monitor the electrolytes, renal and hepatic function, and avoiding any delay in initiating the cooling measures are the thumb rules for management of heat stroke. Now, which is the vulnerable population? We always call elderly and infants as the vulnerable people because they have very poor thermoregulation. But any outside worker, especially the urban poor, patients who have cardiac, renal, respiratory, or psychiatric illness, pregnant women, and socially isolated individuals, they are the vulnerable population for heat stroke. Now, urban heat island effects are primarily because there's concrete all over, there's asphalt, and there's reduced vegetation. Because of the high-rise buildings, the airflow is reduced. Traffic, industrial emission further worsen the scene. And that's why normally urban temperature is 3 to 7 degrees higher than the rural surroundings. And as you can see in this diagram, the urban heat island effect actually makes this urban area as an island which is full of heat. The heat is coming in, it's just not going out. So it becomes an island of hot area. Now, public health impact is, as I said, increase in mortality, increase in hospital admissions, strain on emergency services, ICUs, reduced workforce productivity, water shortage, electricity demand, impact on food security, mental health. These are all the public health impacts of heat waves. The construction workers, the traffic police, farmers, industrial workers, they are at high risk. It definitely reduces concentration, it increases accidents. Loss of productivity will lead to major economic implications, and occupational safety becomes jeopardized. The idea is number one, there should be early warning systems linked to meteorological forecasting. There should be public advisories through media and community outreach. Cooling centers and emergency preparedness should be there. There should be coordination between health, municipal, and disaster management. And there is something like which is called Ahmedabad Heat Action Plan, which has become a kind of model for uh, in Indian cities. And this is in this they had always sent the text messages out. They had made heat resilient buildings. They had region specific heat wave zones, and there was a lot of coordination between government agencies. Then, of course, the role of hospitals and healthcare system is very, very important because they should have heat emergency protocols. Healthcare workers should be well trained. There should be hydration and cooling resources. The surveillance and reporting system should be strengthened, and ICUs should be prepared. To prevent Outdoor exposure should be avoided during peak afternoon hours. Hydration and light clothing must be promoted. Public awareness, green cover and shaded public spaces should be increased, and community outreach should be made. And long term, of course, as Professor Hariharan was saying, we have to think of climate resilient urban planning, cool roofs, reflective surfaces, expansion of public green spaces, renewable energy, sustainable cooling, and integration of climate adaptation into health policy. These are the basic long term solutions without which our earth will just become a fireball. And so I would say our key takeaways are: it is an emerging public health emergency. Climate change is accelerating the extreme heat events. Preparedness and early action saves lives. Healthcare systems must adopt proactively, and public health, urban planning, and climate policy must work together. Thank you.
Very lovely, Dr. Jyoti. Thank you so much. It's comprehensive. Essentially, your focus is greater on the the medical impact,
Being a
and of
doctor,
course, you touched upon the preemptive measures we need to take in order that we are able to, ensure that we do not have such, such very sad situations that we are having in the country. And it is not, as you know, it's not confined to India. Italy is just now going through a similar predicament of extreme heat waves.
I again lost
Oh,
the sound.
Paris went through a very bad heat wave last year when 45 people died within, the Greater Paris area. So it's therefore not confined to only these parts. Of course, I agree with you that South Asia is a lot more vulnerable because of our latitudinal geographic location. But I believe that this is not something that is confined to only South Asia. uh, Europe has had also for reasons that are beyond us, and now this El Nino impact, which is going to be seen the next 5 years. We are already seeing this year that our monsoon is going to be down to about 90% of its fullness. I think we have a lot of bad news before us. Dr. Pandey, I think, yes. Yes, Dr. Pandey.
Is it over for you, Professor Hariharan?
No, it's over to you now. I think I'll leave it to, I think you should speak
Hello.
because, yes, Dr. Pandey, we can hear you. I can hear you.
Okay, okay.
Yeah,
Okay, so
begin.
we had a very comprehensive discussion and slide. So you covered everything, the short-term measures and the long-term measures, and how policy initiatives should be taken to tackle this issue because it is becoming a health emergency. I was going through the papers today and I found that places like, Banda in UP, Sasaram in Bihar, and Balangir in Orissa, mercury is beyond 45 degrees Celsius in almost 50 cities of the country. And it's becoming a health emergency. Heat stroke, as we all know, is, as Dr. Bindal will point it out, is a medical emergency and it is caused by body overheating, which can trigger, conditions like confusion or dizziness, nausea, even seizures, sometimes loss of consciousness, and in some cases, it can even lead to organ failure. Now, there have been heat action plans from National Disaster Management Authority, and in 23 states, heat action plans are on to tackle heat safety but it's only limited to, issuing advisories and, tackling it in as a short-term measure, like you stay hydrated, avoid peak sun exposure, and consume lot of coconut water or buttermilk or ORS, and stay indoors between 12 to 4, and have loose cotton clothing, etc., etc. But beyond these alerts, which is yellow, orange, or red, depending on the intensity of heat, I think this is not going to help us in a long way to tackle this problem, because it is worsening day in and day out. So, what we need to do is to take long term measures at the level of the policy, at the level of the government, and here we could think of changing our infrastructure and its design, and still we don't find many houses which have coating of rooftops with solar reflective paints or high albedo materials to lower the indoor temperature. I think we have to use this practice and incorporate it in the do's while planning for urban infrastructure. Then, of course, our forest cover, green cover is fast depleting. We need to create urban greening and forests. We have to plant dense, multi layered urban microforests, because in urban areas, land is very, very scarce commodity. So, therefore, whatever little land is available, we have to make prudent use of it, and this will lead to reducing temperature and providing natural shade. Then we could also think of having passive cooling retrofills and redesign our building codes in hot climate zone in which most cities of India are in. To optimize, we could think of optimizing window to wall ratio. Windows could be longer, wider, and we could think of having shading devices, cross ventilation, so that there is some natural cooling. In any case, we have to reduce the reliance on energy intensive air conditioning in days to come. And city level governance and policy can take care of things like worker protection policies, things like access to designated air conditioned public spaces. We could think of resource management in terms of our increasing our blue infrastructure, in which we could think of reviving traditional water bodies which mostly are going dry, then the lakes and urban wetlands that act as natural water evaporative coolers. Those things could be revived, and proactively we have to take measures to revive these traditional water bodies and lakes. Then we could think of, water kiosks in terms of medical emergency caused by heat waves, public drinking water, and oral rehydration solutions throughout vulnerable city centers are being resorted to. But it will not solve the problem permanently. And as Dr. Hariharan pointed it out, that the economists, the policymakers, the public administrators, and the politicians, they have to join their hands and come out with best practices. As he was discussing, that Ahmedabad model could be replicated in other cities of the country, and we could see better conditions in days to come if we proactively think and respond to the challenges that are thrown by heat waves. So these are some of the thoughts I thought I should share with you. And as we go along in our discussion, I could join with some more points.
I'm going to take my excuse because I can hardly hear any of you. I think there's a bad network scene. So I'm just going to attempt once
No, no
again if
issue,
I
no
can.
issue,
Discuss.
Professor Bindal. I think
Can you hear
Dr.
me?
Narayan.
Yes, yes,
Uh,
yes,
I,
Professor
I
Narayan,
want to
we
say
can hear you.
something. No, no. I
Yes.
want to say something which will be equally important. The number one is that we discussed only about the rural and urban population, but we forgot the tribal population. The 12% of the total population of the country is that of the tribals, and why the tribals are not having this problem of heat waves, because they have their own lifestyle. When we were living in rural India, even today in rural India, you can find many people that they have nothing to do with the heat waves. So this heat wave, there are models even in UNO and the other international bodies for indigenous population, which has been constituted 5 years ago. They made some studies in different country, the different parts of the globe, and they have come out with the report that this is all because of negligence of ecological and environmental status which we are having around us. So first of all, we should recommend that all the urban centers should be developed as per the our available in ecological and environmental status, because the housing, there is a housing system which passes the building maps and all that, which without considering the ecological environmental conditions. So that should be the first things. The second thing is that what are those things which the tribals and the rural population are using and not, which is saving them from the heat waves. These two things, there are some certain studies also in this aspect. If we consider those aspects, then the urban population suffering from heat waves comes to less, it's lesser. And the urban population needs to be educated that they should not come out only with their own problem, but they should understand what the people living on the other side of the globe, they are practicing that they and saving themselves from the problem of the heat waves. Is that not like a fashion which has become to for 2 3 months we talk about this heat wave, and this is heat waves is not the global problem. It is concentrated in certain pockets of the different countries. So we should be initially we must have that list, that which are the country which is suffering most, and which are the humanities, which are the human population with what physical characteristics who are suffering more than those poor people or the tribal people. So if we have that model, then we can go for, then it will be better to say that we need this or we need that, because only on the urban population is less than the total population globally of the tribal and the rural population. So the majority of the population, we are not talking about the majority of the population. Of course, the problem of heat wave is there on the which on the in the urban city where it is very unsystematic. Houses are building, people have no living style, lifestyle. Children are growing in a different way, different from their own cultural background. So these things needs to be given priority than for giving that of the only about the medical things. So the medical things will do a little only in urban center, but not in rural or tribal centers. So we must think for those poor people who have no access to the medicine, who have no access to a doctor. So how they are saving? So can we take that example, and we can say recently one man from Chhattisgarh, living in the most interior area of Chhattisgarh, he has come out with a theory with the example that these are the things if you take in summer, then it will be there. And even today, in Chhattisgarh or in Sikkim or in such other states, we do not have the problem of these heat waves. So this is a centralized. The heat waves problem is centralized to the most urbanized center. So of course we should go for the policy. Our policy needs a differential approach for the most uh, urbanized city and the most primitive city. So far, the heat waves are concerned. So we must, first of all, we should have a study in context of India, that which are the states and which are the city which is most suffering. Earlier, say 30 years or 40 years ago, it was the Gaya and the Bodh Gaya which had a lot of heat waves cases. But today they don't have. The reason is that the food habit has changed in last 40 years in Gaya and both Gaya. So that this is a small study which I have done, and I have come to the conclusion that it is the intake, it is the food intake and the water that gives you safety from this heat wave. So if it is the case in these two small places, then it can be also found in some other urban cities and so I am very much thankful to Dr. Hariharan and Sri N. Pandey that they have brought up a very important issue, but this aspect was neglected from your discussion. So I thought that I must bring it to light to all of you, and we can think of a holistic approach to solve the problem of the heat waves, and should try to come out with a list of the food which the uh, people living in the deep forest area are taking, and which saves them from the uh, this heat wave or any such other sufferings, diseases. That will be more useful and that will be more practical than going for a long-term planning and all that. Because that we don't have that much of a fund here in India. So whatsoever fund we have and whatsoever population we have, whatsoever our ecological balance, ecological system we have, considering all these, if we go for a policy, then it will be better instead of going for the only medical aspect of this. Only, only medical aspect is not going to serve our purpose in country like India or Pakistan or Sri Lanka. It's not that people are not that rich that they can go and approach each time for this thing. So this is my humble suggestion, and this is part of my study which we have done. Recently, the Society for Empowerment has done this kind of a study. So, on the basis of that, we can recommend even to the government of India and to the international body which is 5 years ago, which was constituted in UNO, and that is still functioning for indigenous population. If we go through those reports, I think it will be better, and we can have another discussion on the subject next time, and then whatsoever we will recommend that may help the country in formulating the policy. Not only India, but Sri Lanka, Pakistan, and other such country can also get benefited from our that study and recommendations. So thank you very much. Initially, I had this problem that unable to hear most of things, but now gradually I have come in touch with that. So I think that whatsoever suggestion I made or whatsoever information, research data which I have, I shared with you. If you all agree, then we can go further for one more such webinar with internationally, with collaboration with the International Association for this for this problem, heat waves problem, and then we may be really helpful for the
Sure.
whole for the world. Thank you very much for that. Must do.
Thank you, Professor Narayan.
Thank
It's
you
very
very
good
much,
question.
Professor Narayan. What you have come out is very novel idea and based on your research. So we should definitely have one more webinar and the recommendations which are based on evidence and experience must be shared with all and this could find amongst our recommendations to Government of India, so that the traditional way of life, traditional way of living, the traditional infrastructure, the traditional design of houses, the traditional food, and all this carries respectability in the eyes of the policy makers and planners in this country.
Right. Thank you. Thank you, Mr. Pandey. And if I may be permitted, Professor Narayan, I
I
shall.
think I was not audible.
No, you were audible. We could hear
No,
you.
no issue, no issue.
Very loud and clear. You came across very well, and your points are well taken. And if I may be permitted, I shall share only 4 slides. And let me, uh, just one moment. I'll share a screen. Slides. Okay. Your computer. Ah, well, I'm not able to share a file. How do I do a share of file? Uh, Subhashji, are you there? Can you tell me how I can share a screen? Share screen. Okay. Inbox selected tab. Okay. Well, I'm not able to do that. All I will say is this. I don't want to, waste too much time on this. Essentially, over 3 cities of Bangalore, Chennai, and Hyderabad, in association with the National University of Singapore, the Habitat India Forum, which is based in Ahmedabad. And as Dr. Jyoti said, Ahmedabad has been a pioneer in this system of alert warnings that we can offer. And Ahmedabad started this in 2010. We started this in the old city. I was part of the Ahmedabad Study Action Group, ASAG, along with with architect Kirti Shah and others. All I am saying is that there is clearly possibility, as Professor Narayan said, that in our cities, which are taking the highest of the impact of such heat waves, we can bring in a few shifts and revisions and changes and minor ways of looking at the master plan in a way that we increase the density of green. If, as Professor Narayan said, in our tribal pockets and in most parts of central India, for instance, the forest cover makes it easier for us to see that the impact on the local settlements is softened. The tribals are not therefore as impacted as people are in the cities, especially if they are poor. My own understanding, after some meetings with many fishermen on the coast in Chennai, we met. There are about of the 14 million people in Chennai, about 3.5 million people are fisher folk who are living on the coast on a longitudinal length of, I think, about 80 kilometers north to the south of Chennai. And what we are finding is that the impact is the highest upon these people on both fronts when they have a flood or when they have a high heat kind of situations of the kind that they have had even this summer. The summer is wearing out. The summer is intense just now in Chennai. And Chennai, unlike continental cities like Patna or many other cities inside the country, has this problem of high humidity also. If you go to Varda, for instance, places like Yavatmal or Hinganghat and place even Nagpur, you will find that the challenge is one of dry heat. Ahmedabad has dry heat, but on the coast, our challenge is also one of humidity. So this dehydration becomes, therefore, as Professor Narayan said, and Dr. Jyoti was also saying, a very serious problem that we need to take further. My last observation, I wish I could share with you some slides. I'm not able to do that. My last observation is that what Professor Narayan said about his own empirical study showing that intake of food and rationalizing the diets of people that he did in both Gaya and in Gaya, he said, I think, is something that should possibly be taken with some very specific recommendatory framework that is offered, especially for these 95 to 100 cities across India, Professor Narayan and Panditji.
So, Professor Hariharan, you touched almost all the points uh, related to this topic of heat waves, what it is, how to tackle it, and how to mitigate its impact. I think Professor Narayan, I could not hear him completely, only the last part of it I could hear. He had also given a very novel and personal experience based on his study carried out in Bela Ganj block of Gaya district. And he has written a book which came out only recently on Saurya Pahadia tribe of Bihar. And he has done a lot of work with Tana Bhagats in Jharkhand. So he is very much, familiar with tribal way of life, how they live, what they eat, how what they think, what are their pluses and what are their minuses. So we go by what he says. And on the policy level, I think there have been, initiatives taken, but we need to be on the alert and we have to prioritize things and give it a top priority. Particularly, it is becoming a health hazard in most of the urban hamlets, urban habitations. So, therefore, I think in totality, as Dr. S. Narayan pointed out, we have to do some holistic thinking and come out with our set of recommendations and forward it to the policymakers so that it helps out mitigating the situation better. So, thank you. I think if we have nothing more to add, then Professor Narayan or Subhasji can think of, uh, rounding the discussion.
Yes, sir. This was really a wonderful discussion where Dr. Hariharan shed a light on the study that has been undertaken at the Bangalore or the metropolitan city and the coastal city, whereas Dr. Narayan threw light on the indigenous population and the rural habitats, adopting the dietary aspects and yes. Erin Pandey sir had thrown a light on the administrative aspects as well as with the latest activity that has been reported on the heat waves and the heat islands that have been created at the urban level. And we were also having Dr. Jyoti Bindal, wherein she shed light on the medical aspects and the remedial aspects. So this was really a wonderful session where we had an opportunity that the great luminaries were there, and we are looking forward for more such sections. Thank you
Sure.
for the society for
Thank you
this.
very
Thank you.
much.
Thank you.
Thank
Thank
you.
you.
Thank you.
Thanks a
Thank you.
lot.
Namaskar.
Okay.
Thank
Bye.
you. Namaskar. Thank you.